Hi, I'm Pat Iyer, the Chief Editor of the Medical Records Analysis, Volume 4. With me today is one of our authors, Dr. Beth Sanford, who is a nursing professor and passionate about a subject that I knew very little about before I edited her chapter. What did you write your chapter about, Beth?
I wrote my chapter about vitamin D deficiency in pregnancy and the consequences to the mother and her newborn.
Why is this an issue for pregnant women?
Vitamin D deficiency in pregnancy is an issue for pregnant women because it leads to so many complications. For example, is preterm birth. And that is one of the issues that really leads to increased morbidity and mortality for pregnant women and the newborn.
And we know there are so many things that can impact pregnant women and their infants. Is vitamin D deficiency on the radar for the physicians who are taking care of pregnant women?
I think you're right, Pat. There's just so many factors involved in maternal morbidity and mortality and neonatal morbidity and mortality. I think that it's not on people's radar. But truthfully, when you look in the scientific literature, it's really one of the lowest of the low-hanging fruit that can improve maternal and neonatal health outcomes.
And as I learned from editing your chapter, there are blood tests that are available to indicate what the vitamin D deficiency levels are. And very simple and inexpensive supplementation if you're paying attention to it. Could legal nurse consultants and attorneys encounter a case in which a mother or an infant is catastrophically injured by vitamin D deficiency?
Oh, 100%. As I've spent the last 5 years, really spent a lot of time in the literature and educating healthcare professionals on this topic, I've learned that it's just something that is truly not on their radar. They are not well versed in what vitamin D deficiency looks like in pregnancy. They're not well versed in the consequences of its deficiency and the outcomes of the mother and the infant. My guess is we are looking at over 50% of maternal health cases could have a vitamin D could be a factor.
This is definitely a chapter that you're going to want to read in our book, Medical Records Analysis, Volume 4. It'll be coming out and available at the link directly below this video, LNC.tips/MRA4. And you'll be able to read Dr. Sanford's chapter on this topic and get educated on the consequences of vitamin D deficiency during pregnancy. Get your copy of the book in order to get Beth's tips, and we appreciate you watching this video.